In this next set of videos, I want to go over some of the different types of medical imaging that are most commonly used in clinical practice right now, and give you some of the highlights on what and when they're used, how they work, what their advantages, disadvantages are, and when you might see them come up either in a sports or a clinical context. So the first one I want to talk about is plain old-fashioned X-rays. These are sometimes also called radiographs. This is why people who interpret medical images are called radiologists. These are very old, so this, I think, probably over 100 years ago, X-rays were discovered. It's called X because it was unknown. It was like some unknown source of radiation. But today, X-rays are a relatively high-definition way to image bone specifically. You can image a few other things with it, but really this is for bone. X-rays are super fast. It takes like 30 seconds, if that. They're cheap, relatively speaking, of course, meaning only a few $100s versus a few $1,000s. And today, these are imaged digitally. Back in the day, it was like old-fashioned cameras. You'd have film that you'd use in the X-ray machine. It was like an X-ray camera, but of course today it's a digital image. Now, this is like pros for the X-ray. Fast, cheap, good for imaging bone. However, X-rays, as the name suggests, involve radiation, ionizing radiation. Not a lot, but enough that you wouldn't want to be doing X-rays willy-nilly on young kids, for example, especially in larger areas of the body, like the chest. X-rays can also miss things. And by miss things, I mean pretty much anything in muscle, tendon, cartilage. You won't be able to see it at all. Right? This is an X-ray of the knee joint. It's great for visualizing the shape of the femur, the patella, the tibia, but we can't see any of the muscles, any of the tendons, any of the ligaments, any of the cartilage that's in here. And as we'll see in some images in the next videos, there's a bunch of stuff in this area and over here and over here. That's really important, and that stuff just does not get picked up on an X-ray. A subtler point is that the lower resolution of the X-ray, lower resolution, also means you can miss smaller bone things. And by smaller bone things, what I mean is stress fractures, specifically. A few other things also, but primarily stress fractures. So you can have a situation where somebody has a totally healthy looking, say, tibia or fibula on an X-ray, but in truth they have a stress fracture. And the reason you can't see that is because either it's too small or the pathological changes at the tissue level, like swelling inside the bone marrow, just don't show up on an X-ray. So X-ray is usually the first thing that people will do when somebody comes into a clinic with, say, ankle pain or shin pain. But quite often, there's a lot of other things that will not show up on an X-ray. So this is the oldest, cheapest, fastest, most commonplace thing, but it does have several disadvantages.